am from South Africa, and I am the Group Trauma Emergency and Transplant Manager for the LenMed Health Group. And we have hospitals in South Africa and then also in Botswana, 2 hospitals in Mozambique, in Beira and Maputo, and then a hospital in Accra in Ghana. So we'd love doing work in the African continent, and I'm very passionate about what we do from an emergency nursing point of view all over Africa. So thank you very much for the opportunity to share a little bit on my thoughts about advanced emergency nursing. So I have one disclosure, and that's the fact that I'm an emergency nurse, and in my heart and my soul and my bone and everything that is in me. And I hope to continue with this journey for a long while still. I do give you permission that my slides and the content of this presentation may be shared on social media. So I want to start off by saying working in the field of emergency medicine and the incredible journey that we are fortunate to be part of, because it really brings about every single emotion, I think, that you can think of. We experience the highest of high, I think, if you get an opportunity to deliver that newborn, sometimes in the backseat of a car that just arrived at the entrance of your emergency department, that absolutely feeling of that high that you experience when you do CPR on a patient and it turns out to be very successful, and you can see that this patient is going to have a very good outcome. But the other side of being an emergency nurse is that we also experience the lowest of low. I think you've all experienced managing a patient that presents to the emergency department due to intimate violence from a partner, and sometimes seeing that same patient presenting at your unit for a second or third time, and the injuries just get worse and worse. I'm sure you've all experienced the death of a pediatric patient in your unit, which to me, I think is one of the lowest that I can experience. Or even when you manage a teenager or a young person that's been involved in a motor vehicle crash that you send off to ICU, and you know that this patient doesn't have a good outcome. So our dear Florence Nightingale wrote a letter, and in that letter, which was dated 15 November 1854, she wrote, "On Thursday last," and that was the 8th of November 1854, "we had 1,715 sick and wounded in this hospital, among whom 120 cholera patients and 650 severely wounded in the general hospital, when a message came to prepare for 510 wounded patients." Now, this might be written in 1854, but I think you all can relate with me that as emergency nurses, we have had similar experiences and similar messages due to the high volume in patients in some of our units. Overcrowding that is, I think, not out of the norm anymore. Overcrowding has become norm and part of what we need to manage in our units every day. And in the South African environment, I often receive messages of, please can the emergency department go on divert because we are at capacity. Now, unfortunately, in the start with Florence Nightingale, there were no social media, no WhatsApp, no SMS systems that you can send out, hey, my hospital is on divert. And I think for many of us in different environments that we work on, this is what we need to deal with, is that we are it. This is the only place that our patients presenting with an emergency situation can come to for medical help, and we cannot turn them away. So if we look at just at the topic, which is overcoming challenges to enable advanced emergency nursing, how to start thinking about what does challenges means. And a definition that I found in the Collins Diary said, a challenge is something new or old and difficult, which requires great effort and determination. Now, if you think of your setting and where you practice in, how many of the challenges sometimes are new, but I think a lot of our challenges are old and difficult to fix. We just spoke about overcrowding, which is ever since Nightingale, clearly a problem and a trouble and a challenge in many of our emergency department settings. But we also look at enable. So enable is something to happen. To enable something to happen means to make it possible for it to happen. And I know for us as emergency nurses, we definitely have that skill inside of us that can think of ways and means to act and enable things to work and change and perform and be better. I always say working in emergency nursing, it's a black and white career. You either like it a lot or you don't like it at all. There's no in between. And all the emergency nurses I've met before and is working along me, and I really share that compassion and that drive and that enthusiasm for what we do. And I definitely believe that we are able to enable things to happen. And that is what makes us advancing emergency nursing for future. So if we look at our challenges, I think we take care of patients in a wide range of situations, from fever, the child with severe fever, from minor injuries to major trauma, to the stroke patient, to the anaphylaxis patient, to the cardiac patient. Really encompasses a basket full of different patient scenarios that we need to be ready for on a daily basis, because we never know who and what is going to present through our front door at the emergency department. But I do believe we have 3 superpowers that enable us to do change. The one is quick thinking. We definitely skilled, trained, equipped with quick thinking on our feet in many clinical situations and many day-to-day actions that we need to do. We are able to do decisive action, and we definitely have a strong stomach. I think you can spot the emergency nurse in discussions where other people will squeal and won't be able to finish their meal, and we can just continue to talk about whatever comes up, whatever smell is around, whatever we face with, while having that little sandwich. And although I think the infection prevention nurses will roll their eyes if they hear how many of us have had a piece of a sandwich in our cheek while we were running to do CPR of a patient. I certainly had a piece of chocolate cake in my one cheek at one point when they called for CPR. So that is what makes us so amazing and with the superpowers that we have inside of us. But how do we advance emergency nursing? I think the first part is that we work together as a team. We monitor health conditions, we can administer medication, we can do life-saving interventions, we can give patient advice, communication, education to the patient and their families on acute aspects that is currently presenting, but also on continuation of care, be it at home, be it in hospital. And if I say continuation of care, we're also in that environment that we can start talking about palliation. We are the first line of defense for many trauma and medical patients presenting, that first point of contact that they know that help will come from. We are able to quickly assess the needs of each patient, prioritize care based on the critical nature. We can work together to stabilize the patient, treat the problem, know where to go, transfer the patient to, or sometimes provide enough care that the patient is discharged or transferred to another facility. So if we look at these 2 concepts, number 1, what is our challenges? And number 2, what are we going to do to enable ourselves to move forward and continue with our career of emergency nursing? So looking at the challenges for nurses in Africa, and I want to say Africa because it's not only to South Africa, and I think many of the things that I discuss here is a worldwide phenomenon at the moment, and that is understaffing and acuities. I have a daily fight in my organization With senior, sorry, was there a question? Not. With senior nurse managers not understanding acuities in the emergency nursing environment, I think we're losing a big pool of our trained emergency nurses, our trauma nurses, to the international market, which creates just a bigger and bigger nursing shortage across our African continent. And that includes then the shortage of doctors, leaving us as nurses to endure a lot more on guidelines and standards and what we need to do for our patients. In many countries, the emergency nurse scope of practice is very much undefined. And we in South Africa worked a couple of years ago, 9-10 years ago, on the scope of practice for emergency nurses, because we realized that we are not intensive care nurses. We are specialized in our own environment, and we need to have a more defined scope of practice. And because of that, because of the low doctor ratio, because of where we're working with low resources, many of the nurses are then forced to work outside their scope, which creates frustration, definitely, fear of being out of their scope and not being protected, and opportunities for occupational health hazards. So limited basic knowledge and skills of emergency nurses is a problem. We have a limited number of nurse trainers who can develop and train potential future young nurses to the skills to work in an emergency setting. And I think most of you can relate to these general challenges. Looking more specific in South African context, this was statistics by the South African Nursing Council released in 31 December 2021. If you look at the age group of less than 30 years old to 49-year-old, which is the bulk of our workforce, it encompasses just over 50% of the workforce. Now, how long is that going to last to continue to grow and groom and educate emergency nurses for future? How many of these nurses that is on the register has already left the country and is now working outside the African continent? So again, this data has been released for the 1st of January 2022, which shows on the register at the South African Nursing Council, there was 59,855 nurses registered. If you then look at the population per qualified nurse, it's 1 nurse to 386 patients, which to me is an alarming number, because I think you can almost double that number looking at, again, the number of nurses that has left to work internationally. On African continent, as on April 2022, they estimate that there was 83 nurses per 10,000 population. And in 2022, the WHO study said that there was 1.55 for physician, nurse, and midwife per 1,000 patients. So looking at that 1.55, that is combined physician, nurses, and midwives. So if we exclude the physicians from that, the number for nursing would be even smaller. So what is our internal challenges to really advance emergency nursing for us in the African continent? Training. I think, how many of your facilities provide focused emergency and trauma training in the aim of creating a specialized nurse? Do we have our own ethos and standards that we can live by? How professional are we in protecting our specialized career path as nursing? There's a huge problem, in my view, from an attitude towards our profession and patients. Who of you are very, in a conversation when they talk about careers and especially with school children about career opportunities, speak up and say, hey, I'm proud to be an emergency nurse, I'm proud to be a nurse, and promote the profession that way, or are you ashamed? I think the attitude of many nurses towards non-compassionate care to our patients also bring quite a bit of harm to our career and the profession that we hold close to our heart. Staffing, I touched on already. I think it's a huge issue. And if we don't start internally to promote emergency nursing and advancing emergency nursing, staffing is going to become a bigger and bigger problem. Do we do enough research? Research by nurses, for nurses, understanding the need of what is the requirement for emergency nursing, what we can do to promote emergency nursing, what is the general challenges out there in each of our units. Do we look at patient outcomes, and what we're doing from a clinical aspect is improving patient outcomes, or do we just rely on what the doctor is doing? And then lastly, from an internal challenge point of view, I put on who is on duty. Now, that is a big issue to me, because if you're working in an environment where you are supported by a pre-hospital service or services, and you are the rude nurse on the shift, that EMS service are definitely going to think twice before they come to your facility. And that is many times to the disadvantage of the patient not taken to the appropriate center of care. Now, this is us, and I think this 3 images just explains what we are and what we can do so clearly. The ICU nurses, and my apologies to any of the ICU nurses on the call, I have a huge amount of respect for you, but you have everything sorted, flagged, prepared, the patient is washed, the linen and the sheets are nicely tucked in, and here comes the emergency department with absolute chaos. But that's where we function, and that's where our passion is. And the more chaos and the more adrenaline we have and the more the pace is, the better we function, because that's what we're wired for. Looking at external challenges for advancing emergency nurses, I think the first one is medical insurance companies, medical aids, healthcare funders, who has a lack of understanding of emergency and trauma systems. I think in many scenarios, the bigger focus of healthcare funders are on the inpatient, the surgical patient, the medical patient, the critical care patient, and not so much always towards the acutely ill or injured patient that is presenting to emergency department. And for many of the hospitals that I dealt with, you can clearly see that was a hospital that was built, and then they realized, oh my goodness, we don't have an emergency department, and let's just stuck the emergency department in and squeeze it into this very small space. And I think predominantly that is because of a lack of understanding of the critical importance that we play. In South Africa, in my country, unfortunately, we started with a reward system, and I don't want to call it a reward system, or an appreciation system is the better word, where we thank the EMS when they bring a patient, and we appreciate the work that they do, and they get a voucher, or they get a buy and a chips and or snacks. And we don't want pre-hospital providers to come to my emergency department based on whether I'm going to give him a chocolate and a Coke, or chocolate and a crisps, or whatever I'm going to give him to thank him for his work that we're doing. We as emergency nurses need to provide a platform that no matter what, if there's a pre-hospital provider, they want to come to our facility, A, because the quality of the emergency nursing care, B, of the improved outcomes, and they know that their patients will be taken care of and be safe in the care that we will provide. This picture that you see here is really linking into the trauma system, emergency system, EMS point of view. And again, on what I just said on providing that optimum care to improve outcome for both the medical as well as the trauma emergency case. And that pre-hospital providers will bypass hospitals to ensure that they get to the closest but most appropriate center of care. And appropriate center of care is what I just explained. quality of nursing care, quality of doctor care, safety for the patient, improve outcomes, and the list can go on. I think another challenge that we have, and it links to my slide with Florence Nightingale, is overcrowding, hospital bed availability, budget. How small is the portion of the budget to the emergency department compared to the rest of the hospital? And I do respect the fact that the emergency department is a lot smaller compared to the rest of the hospital, but it plays such a critical part for bringing patients into the hospital for further time management. So what can we do to enable ourselves to advance emergency nursing? I think the first one is to overcome challenges, improve workplace environment. So how do we staff? Is there any promotion and growth opportunities for emergency medicine nursing or emergency nurses? Do we start thinking of strategies to improve overcrowding by starting splitting the unit maybe as a outpatient department where your more critical patients and higher priority will go into the emergency department staff? Information about our job descriptions. How clear is the job description that is written for the emergency nurse working in your facility? Is it an HR document that says a lot but actually says nothing? Does it really explain and give an understanding of what we do and what we are capable of doing? Does it clearly stipulate clinical tasks versus non-clinical tasks? And I think if we start looking at the balance between clinical tasks and versus non-clinical tasks, I think as emergency nurses, we would be shocked to see the percentage compared to each other. It's critical that we promote teamwork between emergency medicine nurses and doctors. It's not us versus them. And the sooner we start working together in a team, and the sooner we start standing up for what we believe in being an emergency nurse, that we are skilled, that we are trained, that we have the knowledge to work together with the doctor. I want to pause here for a moment, and I just want you to reflect a little bit and maybe go tomorrow and ask staff working with you. I often ask emergency nurses working with me or for me in my units, who do they see is part of the multidisciplinary team? And they would say, oh, it's the doctor, and it's the physiotherapist, and it's the occupational therapist, and the dietitian, and the pharmacist. And they would mention everybody. And sometimes they would, or sometimes only at the end, they would say, and the nurse. And I want to challenge all of us to start mentioning the nurse first as part of the multidisciplinary team. Yes, we are part of the multidisciplinary team, and we gave that privilege away by not claiming it. That patient, Mr. X, is as much my patient as what it is the doctor's patients or the physiotherapist patients. And I think once we start standing up and claiming our position within the multidisciplinary team and claiming ownership of these patients, our status and respect as emergency nurses with the knowledge that we have will be surprisingly higher. Education, education, education. I think for the public and an understanding of what we are, who we are, and what we can do. Same to the pre-hospital providers, healthcare providers, medical insurance companies, healthcare companies, decision makers need to understand the value that the emergency nurse is bringing to the acute and emergency care basket in managing all patients. I think it's important that we start creating an elite unit feeling. If we portray that we are proud to be an emergency nurse, that we have the knowledge and skills to be an emergency nurse, that we are also a specialized unit, that we are an elite unit, and not only the other specialized areas that emergency nursing and emergency department is not the throwaway child sitting in a corner, but that we are an elite unit with amazing skills and competencies, and luring more and younger nurses to join this elite unit and group of emergency nurses. It's critical that we invest in education and research, and I've mentioned it before. Mentor versus mentee programs. How many of you have this in place? And I want to really say, through AFEM, we have this platform to create a mentor versus mentee program on several different aspects of emergency as well as trauma nursing. Some of us are really good in running quality improvement programs. Some of us are really good in writing policies and pathways. And there can be such a good program on mentor and menteeships. It doesn't have to be a mentor for somebody in a whole aspect of emergency nursing. It can be components thereof. Now, I want to take you a little bit into the future and into the growth of emergency nursing. And I spoke about the enablers, but what we are capable of doing. Oh, sorry. And I really want to take you on the journey of the power of a step and really taking that first step. So on the right, you can see our old nursing shoes. And I think for most of us now, that has changed into running shoes and the most comfortable shoe that we can wear, because we are running and on our feet for 12 and sometimes longer hours per shift. Now, steps are symbolic of our journey points, and it represents motion, movement, and going into some sort of direction. Steps are ever present, and they present that what's been here all along, the journey that we are on. You know, I was actually, when I did this slide, I was laughing because I have a Garmin watch, and a big part of my day is I just have to achieve my 15,000 steps per day. And come to the end of the day, I'm like, oh my goodness, what am I going to do? I haven't achieved my steps. And then I thought, but maybe we should think about it the same. We haven't achieved the steps that we should to advance emergency nursing. And what should we do to get that extra few steps in to achieve that on a daily basis, on a minute-to-minute basis, on a weekly basis, in planning for the future? Because it's sometimes just showing a novice nurse what to do and take her by the hand. I will clearly remember my very, very first resuscitation. It was a motor vehicle crash patient. And I was privileged at that time. I was in the South African military. And in the room was a Captain Kathy Grant. And afterwards, I walked out and I said, it was so quiet. And she said, yes, there's no reason to scream and shout. And that really stuck to me. And I tried to get that same calmness, control, preparedness that I experienced that day to every single junior nurse that I exposed to resuscitation after that and throughout my career. So what is in the power of steps? It requires action. You actually need to take that step. It can reveal to us how fit we are, how fatigued we've become. So let's look at our steps as emergency nurses. Are we just tired and say, it is overwhelming, we will never have enough emergency nurses, nursing is in a crisis, we are tired, we are done? Or are we going to say, look at the amount of steps we have taken all these years? It created determination and a level of fitness for us to think on how to advance our career. Steps are designed to lead somewhere specific and not to stay in one place. We want to work, we want to improve, and we want to advance emergency nursing into an elite unit, into a specialized nursing group for future patients that we're going to treat. It implies transversing, that we step up from or down from our old views and find different perspectives. Is it not time for us to stop and think on what we've done up to this point and what can we do different collectively as a group, maybe within AFEM, to advance emergency nurses? Also symbolizes resting points where we can sit and gather our resources, catch our breath, and decide how to go about the next step. And I think what I've seen so often on the WhatsApp group of AFEM is exactly this, sharing ideas. And then looking at it, I'm like, I'm not the only one with this problem. Let me just sit back. But I think we need to knock on other nurses' doors and say, I know I'm in South Africa and you might be in Kenya or in Zimbabwe or in Ghana. But what did you do to fix this situation and learn from each other? It gives me a time to catch my breath because somebody else might just have the solution for me already. So where will our next step lead us? Always begins with just one step. And sometimes even one step takes everything we got, that last little bit of willpower to go, all our focus, all our attention. But first steps are like that sometimes. If you look at a little baby that starts walking for that very first time, that absolutely concentration, focus, and intention to move forward. Trust your feet. They have done 1,000,000 miles. Yes, sometimes in very uncomfortable nursing shoes, and sometimes in running shoes, each with their own experience that you bring along. So trust your feet in taking you on that journey. I found this called The Power of One, and I want to share some parts of it that really fit to me and what I believe we can collectively do. One song spark a movement or a moment. That one step can spark a moment. One hand clasp lift a soul. One word can frame the goal. One step must start each journey, and one touch can show how you care. One voice can speak with wisdom. One life can make the difference. You see, it's up to you and up to me. I do believe in the power of what we have combined to stand together as one. I do believe in emergency nursing. I do believe in us as an elite unit with so much strength and knowledge, in that we have to do everything in our power to promote the advancement of emergency nursing. So what if Neil Armstrong did not take that step? What if Florence Nightingale did not take her step? And what if we do not take that step? So I want to challenge each one of you on this call, and thank you for joining, to really think what will be that one step that you or your unit will take to advance emergency nurses and continue growing that as such a privilege to work as a profession and a career. Thank you very much. There's my email address at the bottom if any one of you want to contact me, or I am available on the WhatsApp group. We still have a few minutes left. I don't know, I'll open the chat box, or if anybody wants to have a question or comment. Thank you everybody then for joining this afternoon. I appreciate your time, and enjoy the rest of this afternoon.